The Truth About Gabapentin, Part 2. Gabapentin is a gamma-aminobutyric acid analog. Gamma-aminobutyric acid, or GABA, is an important neurotransmitter involved in the regulation of sleep, anxiety, stress, and pain. While many neurotransmitters cause a stimulating effect when they bind to a receptor, GABA actually causes a calming or inhibitory effect. Gabapentin was designed to mimic the behavior of GABA. It doesn't actually bind to the GABA receptor sites in the body. Gabapentin begins to work within just a few hours of taking the medication, and most people will experience benefit from the medication within just a few days, although some people it may take up to a month, depending on what we're actually treating. The half-life of gabapentin is 5 to 7 hours, and that means that it has to be dosed several times a day in order for the person to achieve maximum benefit. Tachyphylaxis, which is the rapid diminishing effectiveness of medication after subsequent doses, is really common and occurs quickly with gabapentin, which requires the dose to be increased pretty rapidly, and people usually become physically dependent and often reach the maximum dose. At this point, often the patient is less responsive to the effects of the medication, but physically dependent on the medication as well. The FDA doesn't consider gabapentin a medication of abuse, and so it doesn't have a controlled substance status, but many states have actually changed the status to a controlled substance status because there is evidence of addiction and abuse. Gabapentin should never be stopped abruptly because it can cause severe withdrawal effects. It shouldn't be combined with alcohol or any other sedating medications. People taking gabapentin should have routine blood work done, especially kidney function testing. That's because gabapentin is cleared by the kidneys, and so if your kidneys aren't working correctly, gabapentin can build up in your body and cause an overdose. Today, gabapentin has an important role in chronic pain management, but it's not without its risks. It increases the risk of overdose when combined with opioids or other sedating products. It can cause neuropsych side effects like increased risk of suicidality, aggression, and anger. But for people with chronic pain, gabapentin may be able to give them their normal life back. Have you taken gabapentin? What was your experience like? Let me know in the comments.